Greiner Bio 1 presents MiniCollect Capillary Blood Collection System. Every drop counts. Venipuncture is not always an option. That is why we have developed an innovative capillary blood collection system to test a wide range of parameters. Despite using only a minimal amount of blood, MiniCollect tube program allows for a wide spectrum of analysis. With its integrated scoop, there is no need for any additional transfer devices, saving time and costs. The wide inner tube diameter and the special internal geometry of the tube ensure that the sample is well mixed. MiniCollect tubes can be used as primary containers for analysis, or, if required, can be combined with a transparent or an amber-colored carrier tube. Alternatively, the MiniCollect Complete tubes are a ready-assembled version particularly suitable for automation purposes. Consider your patients. The minimally invasive approach ensures comfort and the best possible tissue protection. MiniCollect is suitable for a very wide range of patient groups. It is especially suitable for infants and young children, obese patients, patients with difficult vein conditions, elderly, and severely ill patients, and patients with severe burn injuries. Please note the instructions for use for the capillary blood collection. The order of draw for capillary blood collection is different from the order of draw for venous blood collection. Depending on requirements, for capillary blood collection, EDTA tubes are filled first, followed by all other additives, and then serum with and without gel and no additive should be last. Ensure that the patient is clearly identified before each puncture. Always follow the applicable guidelines in your institution to identify the patients and label the sample containers. Prior to blood collection, it is recommended that the puncture site is warmed to help increase circulation. Simple heat packs can be used for this. Disinfect according to the guidelines of your institution and wait until the puncture site is dry. The tube cap opens upwards when you press on the ribbed area on the tube. Perform the puncture with a suitable lancet. Position the lancet so that the cut crosses the friction ridges. This technique provides the greatest sample yield. Depending on the test procedure, it may be necessary to wipe off the first drop of blood with a sterile gauze pad. The first drop of blood may interfere with the analysis result due to a high content of tissue fluid. Hold the puncture site in a downward position. This prevents the blood from dripping away. The blood can be easily collected by holding the MiniCollect tube at an angle. You do not need any other equipment thanks to the integrated scoop. It may be wise to lightly move the tube around or gently tap it on a hard surface to release the droplet from the scoop. Fill the tube with a designated amount of blood to ensure an appropriate mixing ratio of additive to blood. When you have collected the required volume of blood, close the cap again. A clear, audible click means that the tube is properly and completely closed. Gently invert the MiniCollect tube 8 to 10 times immediately after collecting the capillary blood sample. This ensures that the blood sample is mixed thoroughly with the additive. Stop the bleeding by pressing with a gauze pad. To complete our product range, MiniCollect also has a solution for coagulation diagnosis in small sample volumes. Please note that the MiniCollect coagulation tubes are only suitable for use with venous blood. Transfer the sample with a syringe. This tube also has to be gently inverted. Inverting the tube 4 to 5 times mixes the sample with the additive. When used in combination with a 13 by 75 carrier tube or pre-assembled as a complete combination product in 13 by 75 format, MiniCollect capillary blood collection tubes can be used as primary tubes, making them suitable for use with commonly used centrifuges and analyzers. MiniCollect is the ideal system for different patient groups and is perfectly suited for collecting, transporting, and automatically processing capillary blood. MiniCollect capillary blood collection system includes in vitro diagnostic medical devices. Please observe the instructions for use for tubes and lancets, which can be downloaded from our website.